The urinary system, chapter 9 or 10. Just kidding, it's 10. Let's talk about piddling. The structure and the function of the urinary system. So the organs involved would be kidneys, ureters, bladder, urethra. What's the function? It's not just to pee, okay? So it filters metabolic waste. It actually regulates the blood volume, pH, and electrolytes. Maintains the blood pressure via the RAAS system, or RAA system, right? It secretes erythropoietin, I don't know, is that how you say it? Sure. For red blood cell production. It also activates vitamin D for calcium balance. So it's not just for drinking and excreting liquid wastes. The nephron. Dun, dun, dun. You guys talk about the nephron in A&P yet?
No, that's next semester in A&P2 that none of us are taking.
You have A&P too?
No, we're not taking it.
You don't have to take it.
No, I'd kill myself.
Well, darn.
During a respondus lockdown.
Well, darn. Well, the nephron, my friends, is the basic structural unit of the kidney. So if I were to take the kidney, let me zoom here. A little tiny sliver, just going to take this little pizza piece over here. And you have these little windy little tubey things. That's the nephron. Right, so the components of the nephron would be your glomerulus. Thank you, gosh. Bowman's capsule. Tubules. Loop of Henle. Collecting duct. So, this is kind of what it looks like. You got a little ball here. Things run through here. It's kind of intertwined with the cardiovascular system inside of the kidney, right? You got your veins, your arteries, and then it goes down the duct, right? And then you have all these ducts that, filter the blood. This is where your urine is formed, all right? So pulls what it needs out, regulates, the water levels throughout your body. And then your electrolytes, and then you pee out what isn't needed, right? So it's a process. All right, kidneys and blood cell production. So your kidneys excrete EPO. This stimulates your blood marrow to make more red blood cells. All right, if you have kidney failure, you are anemic because you're no longer getting all those red blood cells and iron. You tend to be iron deficient, right? Hypertension can damage your glomeruli. I don't even know how to say these words. Why am I teaching this? All right. It decreases the filtration, and then it can worsen any kidney issues causing kidney failure. So hypertension, kidney failure, right? You need your kidneys to work. Blood pressure, kidney function. So I'm not even going to say it. The Ross system regulates the blood pressure, right? So hypertension will damage the G cells, we'll call it. It decreases filtration, right? This can cause chronic kidney disease, which can result in also worsened hypertension. Good stuff. Stupid. All right, forget that. If you guys really care enough, you can watch a video on how the urinary system and the kidneys work. So let's talk about some diseases, all right? Kidney stones. This is probably, I would say, the most common thing you think of when someone has a kidney disease, right? You can have all kinds of different stones, right? So the definition would be mineral crystals of some sort of mineral forming inside of the kidney. This can be caused by dehydration, your diet, an infection, genetics, and so on. There's a bunch of different types of stones. I actually have some pictures. They're so crazy looking. So the calcium kidney stone is your most common. Your struvite stone is usually caused from an infection. Uric acid stones a lot of times are linked to having gout, because remember, gout is that increase in the uric acid, right? Cystine stones tend to be more rare, and they're hereditary. Then you can have other stones that kind of can be drug related or from mixed compositions of multiple minerals. Gross. Symptoms, flank pain. So you're going to kind of feel it along where the kidneys are in the back. You can sometimes have blood in your urine or nausea, right? Treatment, hydration. Sometimes they have to go in surgically and break down those stones. If they're small enough, they just try to let them pass with medical intervention also. If somebody has a kidney stone, do not massage them. All right? Do not. All right? You can start your more gentle massage again once they're post-surgical, but be mindful of the area where the kidneys are. I want to be doing a whole bunch of deep tissue stuff around the kidneys, all right, in the low back, mid-back, low back, when they have had previous kidney issues. Yeah, I had a client that was a coworker at one point, and she said she didn't tell me until I was near the end of my massage that she had a kidney infection. I wanted to kill her, and let me tell you, she felt like absolute garbage after that massage for days. So this is why it's important that people are honest with us about their medical issues. They might want massage still, but it could actually be, counteractive. Polycystic kidney disease, PKD. Definition is a genetic disorder, right? A lot of times with the fluid-filled cysts. It's a gross picture. So here in this picture is a healthy kidney and your polycystic kidney. So poly means multiple, multiple cysts. Because did we do reproductive yet? Or is that next week? Yeah, because there's also something called polycystic ovarian syndrome. It's also multiple cysts on the ovaries. But anyhow, there's several types of PKD. So one would be the autosomal dominant polycystic kidney disease, and would be, and that is 90% of cases. So most people will have the AD PKD. The AR PKD would be your autosomal recessive polycystic kidney disease. Oh, so many words. This is typically more severe, and it has childhood onset, all right? So happens when you're young. You also have acquired cystic kidney disease. So this develops during chronic kidney failure. You're done for. All right, causes genetic mutations a lot of times. Again, you're going to have flank pain, hematuria, hypertension. So treatment would be blood pressure control, sometimes dialysis, transplant. You can live with one kidney, okay? So I have a client who has one kidney. She actually makes jokes. She's like, I have more organs missing than I have organs left. I'm like, I believe it. I think kidney, I think she had a hysterectomy. She had a double mastectomy. She just had a knee replacement. She's awesome. I love her. Where am I at? I lost my spot. Massage. Avoid deep pressure over the kidneys. So remember, in through here. All right, that's why we're also not supposed to do deep pressure there anyhow, because we don't want to injure your kidneys. That would suck. All right, this guy. I don't even want to try to say it. Pyelonephritis. Let's go. Infection, itis. What? Pyelonephritis or pyelonephritis? Like nephron? Like there's a nephron in your kidney? Listen, we're going to learn together. So inflammation of the kidney tissues. Okay? You can have acute. You can have chronic. You can have I can't even say these words, man. Emphysematous. Acute is a sudden bacterial infection often. So this could be caused from the E. coli bacteria. Chronic can be, again, with anything chronic, recurrent or long-lasting. Typically, if you have this, you're going to have scarring. All right? And the emphysematous would be your gas-producing bacterial infection. This is rare, right? But can be very, very severe. So causes: urinary tract infection, reflux, and obstruction, possibly. Again, you're going to have flank pain. You can be nauseous, sometimes fever, right? So they're going to treat you with antibiotics if it's bacterial. They might give you fluids to get you hydrated. If you have an infection that's acute, this is contraindicated. Like I said, though, if they have any kidney issues, I'm not working on them until they're cleared. That is my personal opinion. I don't want to kill anybody. Renal cancer, with the exception of this. As long as they're cleared by their doctor, if they have renal cancer, I will massage them because chances are the prognosis is probably not great. Right? Unless they have that specific kidney removed and maybe the other one's cancer-free. Right? So this would be a malignant growth on a kidney. All right? You have your renal cell carcinoma, which is the most common in adults. Right? Renal kidney. You have your transitional cell, which affects the renal pelvis. And then Wilms's tumor. This is a childhood kidney cancer. Sad. Kids shouldn't get cancer. It's sad. Causes: smoking, obesity, genetics. Those are just some causes. All right. Hetermia, flank mass. Or hematuria, sorry. Flank mass. Fatigue. Could be all, symptoms of the renal cancer. A lot of times they're going to do surgery, chemo, immunotherapy. Again, we can do supportive touch as long as they're cleared by their oncologist to receive massage. Renal failure. This is loss of kidney function. Acute can happen suddenly. Chronic is progressive. I mean, I feel like those are the two types, but that's kind of what they mean anyhow. Causes: you can get renal failure from, diabetes, hypertension, toxins, and so on. Fatigue. You're going to be fatigued. You could have edema because you might start having fluid buildup somewhere. A lot of times it is legs. Usually they call it your uremic breath. So they say that you have kind of a metallic taste in your mouth if you're having renal failure. I hope I never experience that. Treatment: transplant, diet, dialysis. Avoid deep work and check for shunts. So again, if they're going through renal failure, they're going through renal failure. So at this point, I would say the pros outweigh the cons, honestly. And if, they have renal failure because of cancer, perhaps, again, just make sure they're cleared by their oncologist to receive massage. Let's talk about the bladder and the urinary tract disorders. Good times. So bladder cancer is, again, a malignant tumor in the bladder lining. So here's a cool picture of a stage 4 tumor. Not that cool, right? In the bladder. Types: transitional cell, squamous cell, and then others. Causes could be smoking, chemical exposure. There's probably tons of causes for cancer, right? Symptoms: hematuria, frequency, so urine, high urine frequency, right? You're going to be going to the bathroom often. Pain when urinating, treatment: surgery, chemo, radiation. Got to get clearance again from their oncologist. Painful bladder syndrome. So this is chronic bladder pain without an infection. The cause is unknown. It could be possible autoimmune, secondary issue, or some kind of nerve dysfunction. They would typically have pelvic pain, an urgency to use the restroom more frequently, medication, and bladder training. So PT and stuff might be involved with a painful bladder syndrome. If this happens, we're going to do gentle abdominal work and gentle back work for tension release. They probably don't want their abdominal work done anyhow, but you never know. Urinary tract infection, also known as a UTI. This is a bacterial infection of the urinary tract. If left untreated, it can actually, progress up to the kidneys, all right? Or bladder infection, right? Causes: E. coli, bacterial infection, poor hygiene. Catheters can cause this, so post-surgical, or if you're in the hospital and you have a catheter, you can get an infection also. Symptoms: painful urination, an urgency to urinate. You can have pelvic pain. I'm sure almost everybody in this room has probably had a UTI before, right? They suck. You just have to pee all the time, then you go and hardly anything comes out. It's not great. Treatments: antibiotics, hydration, and then you have the wives' tale of cranberry juice. Now, cranberry juice contains tons of sugar, so if you're going to go the homeopathic route, at least get the cranberry capsules from the store. Which actually, if you have a mild case, it can really help, right? But I've actually cured a UTI from taking cranberry capsules. But don't listen to me. So massage is contraindicated during an active UTI infection, all right? Because if you have any kind of infection in your body, you're not going to want massage. You're not going to want to do massage on them. So no UTIs, no kidney stones. Got it? No bladder infections, kidney infections.
You said
Stay home and cure your urinary tract. Red flags and contraindications. Absolute contraindication would be fever or systemic infections, an active UTI, or the pyelonephritis, uncontrolled hypertension, edema from kidney failure, right? Which is also why you shouldn't just be like, oh, you have edema, let me do lymphatic drainage. Because what if they're having edema because their kidney is failing? So don't just take it upon yourself and be like, I can help your edema without the training. Or if it looks sus. Yes, I use the word sus. Suspicious. Conditional contraindication. So if they're cleared by a doctor to get massage, you might want to still avoid the abdomen and lighter on the kidney area, bladder area. Avoid deep pressure if they're anemic, because they're going to bruise easier, right? Or if they're fatigued. Check for dialysis access sites. All right. Indications, gentle, relaxing touch for stress relief. Boom, baby. We got it.
Yay.
Yay!